be able to communicate with everyone else here. So yeah, let us know where you're joining from. And also, if at any time you see a spinning wheel in the chat and it's not loading, go ahead and just refresh your browser page, and it should work fine after that. Wonderful. We'll go ahead and get started. I'm just going to do a quick intro before I pass it off to our curriculum co-directors. So thank you so much, everyone, for being here. We're so excited to have you all for our kickoff edition of the Canna Talk, focusing on the brand new pharmacy curriculum that was just launched on cannabis pharmacy, the modernization of a novel healthcare industry. As you can see here, we're offering 4 CPE credits for this course. If you purchase the package, if you are not a clinician and not in need of CPE credits, you can still purchase each of the individual modules without the credits. So you can check out the courses and those details at cannabisclinicians.org. A little bit of background on Society of Cannabis Clinicians. For anyone new joining us today, SCC is a 501c3 nonprofit. So we have been around since 1999 and have welcomed clinicians, researchers, advocates, lay people, and everyone to join the Society of Cannabis Clinicians who's interested in learning more about the scientific research and clinical evidence that there is around medical cannabis. We're interested in developing practice standards so that we can really provide the best patient care. And we're really passionate about developing continuing education. As you can see, in addition to this pharmacy curriculum, we've also created a number of other clinical courses on the basics of the endocannabinoid system, the botany, ecology, pharmacology, and also a number of different clinical disorders. So go ahead and check those out if you're interested in continuing your education journey. SCC is also a membership-based organization. So we welcome anyone to join. We have 5 different membership types categories. So if you go to our website and click the Join tab at the top right, you'll be able to see those different categories. If you're interested in joining us, all members get a 20% discount on all of our education courses now and for any courses that we develop in the future. We also have a private online community where all members can interact, contact directly other members, post announcements, share events, and share research that they're coming up across. So please join us in this private community. We would love to have you there. You can view more about our other membership benefits online. If you have questions or interested in joining, but you want to hear a little bit more about it, feel free to contact me anytime. My name is Christine Melentis, and you can contact me at christine@cannabisclinicians.org. Thank you all so much for being here. I will pass it off to Dr. Alan O and Dr. Bobby Vincent.
Thank you, Christine. I very appreciate everything you've been able to do with this. Me? Can everybody hear me?
Yeah, you're a little choppy, but I think we're okay now.
All right, perfect. But I wanted to come in and say hello to everybody. My name is Bobby Vincent. I'm a pharmacist that is currently working in the clinical space with dealing with cannabinoids and, of course, terpene profiles, making sure that we optimize therapy for these patients. I'm currently working in the Virginia area, in Northern Virginia, with a pharmaceutical processor that, of course, has control over the Northern Virginia area. And then additionally, on top of that, I am the first pharmacist on the Society of Cannabis Clinicians Board of Directors. So through that wonderful role, I've had the opportunity to work alongside my partner here, Alan. And Alan has been a great asset, my co-director, to be able to help develop this wonderful, of course, model that we're presenting to you today. It has a host of interesting topics that we'll be diving in today, as well as hopefully some things that you may not have thought about coming from a pharmacist dealing with the cannabis space. So once again, my name is Bobby Vincent, and I'll pass it along to Alan to go ahead and introduce himself as well.
Yeah, thanks, Bobby. Thanks for having me. My name is Dr. Alan Now. I'm a registered pharmacist, lifelong New Jersey native. I have extensive background in retail pharmacy. I pretty much worked in independent pharmacies my entire career, working with alternative medicine as well as some of the non-traditional things that you would see in a retail pharmacy. I started working in the medical cannabis space in New Jersey in 2018, where I served as the vice president of the one of the vertically integrated operators here. I recently branched off, started my own consulting firm called Plants and Prescriptions, where I'll do one-on-one medical consultations as well as industry education and speaking engagements. In the meantime, I've also applied for a retail cannabis license in New Jersey's inaugural adult use market. So hopefully we'll be operational sometime later. And yeah, I'm really excited to be here and share some of the progress. This course, these modules have taken us almost a year to complete, and just goes to show the development of information that really comes and goes. As we move through the process and go through the individual modules, you'll see that the information that we've presented may be relevant today, but at the same time, just keep in the back of your mind that what we don't know in the future is really going to improve as more access to cannabis comes on board, as more research is available, and so on and so forth. So with that, I'm going to just lead on with the questions so you guys can kind of get an insight into why we developed this course. So Bobby, in your experience, what was the biggest eye opener for you when you started working in the cannabis industry as it pertains to healthcare?
Well, I think one of the biggest things that kind of opened up my eyes when I started working in the cannabis industry was that normally when we're in a pharmacy space, we're used to dealing with things that are mostly based in research. And not that things are not based in research in the cannabis field, but you have to rely a lot on what they did mention in pharmacy school, which is your professional judgment. So we have been through doctoral programs where we've been poured in with a host of different things, dealing with therapies, dealing with dosing, dealing with how to assess the patient as a whole and offer our best recommendation for them there. But we're not always doing that. So one thing that I really enjoy about being a pharmacist in the cannabis industry is that I feel like I'm practicing at the top of my license. Not only do I have the opportunity to make sure that the order is fulfilled and as accurate as requested, but I also get the opportunity to work personally with this patient, offer interventions and recommendations that I may not have always had the opportunity to do in other fields of pharmacy. So I'm definitely enjoying the idea of practicing at the top of my license and also, of course, being able to rely a little more on my professional judgment than I have in the past. One thing I want to flip it back to you as well, because I think this is a very, very interesting topic for any pharmacist in general, whether in the cannabis industry or not. But moving to a more granular level, how does traditional retail pharmacy settings compare to what's happening in the medical cannabis facilities? And what are some of the biggest differences that you've noticed, Alan?
Yeah, well, when I started in the industry, I was completely shocked at what was going on. You call something a medical cannabis facility, but at the same time, if you don't have a nurse, a pharmacist, a physician, or any kind of medical representative to be not just participating in the staff, but helping with staff education, training, protocols, SOPs, what are we really doing here? And that was the biggest struggle that I had, to move my role as a clinician into more of an educator role, because on a day-to-day basis, and we'll go through this in the individual modules, the biggest hurdle that I had to really grasp my head around was that when you have a patient who has full autonomy over what product to purchase, how much to consume, and how often to consume it, that really provides a conundrum of oversight, because we're used to just handing people a package that's very nicely labeled, one tablet twice a day for 30 days. But here we had to go back to the beginning of the basics of, okay, what is cannabis? What is a cannabinoid? How is THC different than CBD? And how are these dosage forms going to affect your daily dosage as it relates to your regular prescription medication? So taking a stab at all those retail outlets that we're used to as a retail pharmacist and translating that to a medical cannabis dispensary, it's an uphill battle for sure. And what I saw most was more the opportunity that pharmacists have for engagement. Because if I was struggling with this on my level in New Jersey, where pharmacists are not required on site in medical facility, I can only imagine some of the other states that are in our similar boats, where they don't require pharmacists, but they are treating this as medicine. So
Mhm.
That's really where I saw an opportunity that lies for myself as a retail pharmacist. So what about you, Bobby? Where do you think the gap that currently needs to be filled with education for pharmacists in general?
Most importantly, I think it's the idea of building up that confidence. Since I've been able to launch more into this field as a cannabis pharmacist, there have been a host of other pharmacists that have interest in this field, but don't quite know where to get this information, don't quite know where to build up the confidence to make that recommendation to a patient. So I think creating certain modules like what we've been able to partner to do here, Alan, of course, SEC's overall objective together, just putting education out there that pinpoints exactly what we're looking into. I know we're going to dive a little bit deeper into this later, but Alan was actually the author of one of the modules entitled The Cannabis Pharmacist. And through that module, I think it does a great job of highlighting what we're pretty much discussing right now. Not only what are some of our more traditional roles as a pharmacist, but how we can take those traditional roles and that traditional training and easily acclimate it into the cannabis space. Because I think there's much more fear and concern about what they may be jumping into versus what may actually be a gap. I think since I've been able to acclimate into this industry, I did so clearly not seamlessly. I did go back to school to get an extra degree as well to have a little more confidence. But I think that I had a host of references. I did have a host of different tools out there. The myth that there are no actual research is once again a myth. So I had journal articles as well that I could rely on. And being a part of an organization like SEC put all that at the forefront for me. So there is a gap for education, but I also feel as if the information that can fill that gap is aware and is out there. We just got to make sure it's at everybody's fingertips.
Yeah, and don't discount that, Bobby. I mean, that Master's in Science, it was the inaugural program with University of Maryland, so that's a huge accomplishment, and I applaud you for going back to school after pharmacy school, because that's not something that I'd probably be able to do.
Thank you. I'll tell you, one of my colleagues and classmates from the program, Kristen, is in here as well. Hey, Kristen. But she can tell you it was one of those fun things. Sometimes education is difficult, especially now with all of us having our day jobs and things like that. But I can definitely say going back to learn about cannabis was something that I'd be all willing for. Just like with these modules, I'll stay up all night to learn a little bit more about cannabis. So great times for sure.
There you go.
But kind of pulling in, once I joined the SEC's board of directors, this idea was already idea that you had brought to the table and was already, starting to run with. So what actually inspired you to create this ACPE accredited course?
Yeah, that's a great question. Honestly, I wanted everyone to be on the same page because I didn't have the answers when I started working. So my first source of information was to reach out to other pharmacists that were already operating in the space, seeing what they were doing, how they help their patients, how they can safely integrate cannabis into traditional medicine. And I realized a lot of the practices were similar, but not necessarily universally adopted. And
Mhm.
so what I wanted to do was just pull all of the information that I gathered from them, from experienced professionals, and not just pharmacists, but physicians included. And then took my experience working with directly the patient on the ground floor of a retail outlet and really pair those worlds together so that we're all kind of speaking the same language. We're talking about things in the same light and moving towards the same direction. As pharmacists, we're taught in a very didactic style in school. So
Mhm.
we are going based off of decades of examining clinical trials, clinical evidence, protocols. We're all handed this information, and we're expected to translate that to the patient. Whereas in medical cannabis, we're learning things as we go along. And so, just being on the same page for pharmacists in general, that's really what my goal was in creating this course so that we can, number one, dive into the history, which Dr. Cody Peterson, will go through very in detail of how cannabis was used in medicine,
Mhm.
as well as going through the current struggles that we have as healthcare professionals, whether it be related to healthcare, policy, government control, and regulations that are really influencing how we approach the patient in individual states. And then finally, when we go through the future of cannabis, that should really excite pharmacists. Where there hasn't been a huge amount of innovation in the pharmaceutical industry in the last decade or two. There's only so many XR or CR versions of a medication that can come out
Mhm.
considered a novel drug, right? But here we have 144 cannabinoids that are not really tapped to the level of same degree. Plant science, psychedelics, the whole market is really blossoming into a new integrative field. and to be on the forefront of that, to be able to guide other clinicians and pharmacists. That's really what motivated me and drove me to want to develop this course.
hmm Similar to you as well. I think that while I was in pharmacy school, similar time frame for you as well, it was a period where we saw this on the horizon. This was something that was coming. Discussions were starting slowly but surely, and to now actually be in the space where cannabis as a medicine is at the forefront, it is a conversation starter. It's something I'm excited to be, hopefully, trailblazing and leading alongside you as well, Alan.
Yeah, absolutely. So we're going to dive in to kind of give a high level overview of each of the individual courses. We're going to read the summary to you, but a lot of this information is on the website. But after Bobby goes through the summaries, we're going to kind of go through some of the key pieces and takeaways that we'd like the audience to know, just to get you guys engaged and see what the course is actually about.
Mm-hmm. So I'll go ahead and start off. The first one I'll go ahead and introduce is the Cannabis Pharmacist, a bottom-up clinical approach, which, as I mentioned earlier, was the actual module that our co-director, Alan, was able to put together. So in summary, it speaks to the roles and requirements of a clinical pharmacist in medical cannabis programs and how they vary due to patchwork of state regulations. It speaks to factors and conflicts with federal governing bodies and policies and the patient experiences and how those change with every dispensary visit. We'll also be highlighting how to standardize practices to ensure patients receive superb clinical guidance while maximizing harm reduction should they remain at the forefront of priority for all practicing clinicians in this space. And most importantly, we'll be taking a ground-up clinical approach and working alongside patients that may require a little more, of course, emphasis to make sure they're empowered to make self-motivated decisions as a pharmacist. So one thing that I really enjoyed about Alan's actual module that hopefully you'll be able to see as you go slowly or surely by time is the opportunity that this is something that highlights the easy portion about pharmacy that we may already understand as a PharmD, and how you can take that skill set and acclimate it into the cannabis world without feeling overwhelmed, bogged down, or like you're out of place. Not only are we building upon typical skills like drug-drug interactions, but the most important thing that we do with pharmacy is building that relationship with the patient as well and providing consulting. So all of that, he was definitely able to dive deep into. And as somebody who's reviewed it, I feel as if I left much more empowered to go and speak to that next patient. So thank you, Alan, for all the hard work on the cannabis pharmaceutic bottom-up clinical approach.
Yeah, no, this was my baby. Like I shared this with Dr. Mike Ruggiero, who we're going to have another Canna Talk with. But some of the nuances that we've experienced in medical cannabis on the ground floor, it's unlike the retail pharmacy environment. So having a full understanding of not only how plants get turned into other delivery vehicles, other routes of administration, those key differences can really make an impact on someone. We've all heard that story of someone, taking a dose of an edible cannabis product and they don't feel anything. So they'll take another dose after an hour and then they're still not feeling anything. So they take a third dose and all of a sudden it hits them at once. How do we prevent that from happening? It's a normal conversation that, as a recreational consumer may not be as of a big deal. But when you're dealing with a medical patient who's trying to treat chronic pain or anxiety or ALS or MS or another debilitating medical condition, they don't necessarily have the luxury of really experiencing that because through trial and error, right? So just basically understanding what our role is in how to educate, how to coherently speak to our patients about the onset and duration of action. We know it as pharmacokinetics, but to the regular consumer, they need to break it down to a level that they understand. Onset and duration are one of the key features that we talk about with almost every single patient, and how to safely incorporate cannabis into their daily routines. So beyond that, though, we'll go over the biggest, again, hurdle that I had to cross was the full patient autonomy, understanding that the pharmacist role in itself, we're here more for supplemental guidance versus the clinician that is going to be dictating, hey, the physician gave you a prescription for this. I'm going to make sure there's no drug interactions. And, I'm going to give it to you as a package and basic counseling points. We have to remove ourselves from that comfortability of having that physician who is knowledgeable about cannabis or regular products, medical products, and we have to put ourselves in the driver's seat. We are helping our patients, but we're also sitting side by side with them versus dictating what's happening as we go along. In
Mhm.
addition to that, a basic patient interaction, depending on how much time you have, we'll go through assessments, we'll go through dosing considerations, route of administration preferences, and pretty much what else they need to become successful with using cannabis. So the
Mhm.
idea of conscious consumption, intentional consumption, really plays into the fact when, again, they have full autonomy over what they can purchase.
Mhm.
So those are my key takeaways, and I'm really excited to share that with you. Between Mike, myself, and Bobby, we have almost a decade of experience working directly with medical cannabis patients. So
Mhm.
bringing that to life, putting on paper, will hopefully, encourage other pharmacists to take that leap of faith into getting into cannabis-based medicine.
I agree with you, Christine, as well. If you don't mind sharing the last slide that we just had, that was a flow chart of some of the things we were discussing in that module. I wanted to speak to some of the things that people may not understand as the day-to-day aspect of a cannabis pharmacist. So one thing that was definitely jumping out to me right here that I am frequently doing as well is the route of administration preference. So as you mentioned earlier, I know you were mentioning a little more about dosing considerations, but I want to follow with you speaking more about those, of course, routes of administration and how optimal that is to a patient's therapy and how each patient is different. So normally we're met with a patient as a cannabis pharmacist. That patient may come in with a specific type of product that they already have in mind, or they may already understand, hey, I'm here to pick X, Y, and Z up, and I just need to learn a little bit more about it. But what we've been able to break down with them, whether it's through inhalation, whether it's through topical application, whether it's through a capsule, oral administration, these are type of things that can speak to the benefits of more chronic administration versus an acute administration, something for more of a breakthrough style pain versus a more long-term style benefit. These are things that we already understand from our pharmacy background, but never want to apply it to the cannabis space. So some things that Alan will dive a little bit deeper into is the time of onset for these different forms of administration. So what is most optimal if you're looking for therapy within a 30-minute window, or if you're looking for therapy within a 2-hour window, or ultimately, like we said, we need something quick and short. What can I do if I only need therapy within 2 minutes? So Alan and Mike did a great job of really diving into this and pretty much showing what the day in the life of a cannabis pharmacist truly entails. So once again, thank you for that. I want to make sure I highlighted that for you.
Awesome. Thanks, Bobby. So moving on, next is Dr. Cody Peterson's module. And if you guys don't follow Cody on LinkedIn or social media, he's been one of the leaders in our space when really talking about the science and history of cannabis. So as a quick summary, cannabis, a rich history clouded in stigma. So the journey of cannabis through the millennia is woven between stories of agriculture, medicine, spirituality, and recreation. So the pathway to modern day reformation requires an understanding of how political agendas shaped cannabis into the polarizing topic it is today. Cannabis prohibition and the subsequent war on drugs, quote unquote, has disproportionately affected BIPOC communities, and stigmatization of cannabis and its consumption continues to exist today as a multifaceted issue. Uh, this is a lot to envelop within 45 minutes. And I think Cody did a great job of highlighting the point and the history. Cannabis was used as medicine for millennia before a certain few with political power and a political agenda decided that it wasn't. The history of cannabis, it really dictated, especially this century. We're still dealing with the lingering stigma of calling cannabis a drug, a recreational outlet. And the on one side of the coin, that statement may be true to a certain extent, where we are seeking the euphoric effects in a similar way that we use other substances. But on the other side of it, the spirituality, medicine, the thoughtfulness that it ensues with consuming cannabis. We don't talk about that side as much. And one of the main key components that pharmacists need to understand was all of this existed before cannabis turned into a Schedule One substance. Schedule One designation through the Controlled Substances Act really changed how we viewed cannabis in general. And unfortunately, the byproduct of that is that Black and Brown communities have been disproportionately affected on the war on drugs. So we'll go through the history of how that happened and how it was a targeted approach to these certain populations and how it still lingers. One of my biggest takeaways from this module is that, it really frames the mindset of the patient coming into the conversation. because how can someone confidently call this as medicine when some of their family members or themselves have been arrested for and convicted of a crime for mere possession of the substance? That there's a huge disconnect between perception of this as medicine versus what actually happens out in the real world. So having an understanding of the history and where it came from and where it leads to today, that was the biggest reason why we wanted to highlight the history of cannabis itself. What about you, Bobby? What's the biggest takeaway that you can give to other healthcare professionals from this module?
One of the greatest things that I learned about this, outside of the, of course, inference of cannabis once being in the U.S. pharmacopoeia, it actually having a long, rich history as a medication, as you mentioned, it was also for me the idea that Cody did a great job of highlighting how many different cultures also saw cannabis as a medicine. So not only was the U.S. pharmacopoeia a leader in this, of course, if you are a member of SEC, you're already aware of William O'Shaughnessy's clinical trials and what work he was able to do for the field for cannabis as a medicine. But what Cody was able to do was to really show this isn't something that was just, of course, within the Western Hemisphere, or something that was just within the United States or Ireland, of course, with William O'Shaughnessy. But cannabis at one point in time was recognized worldwide as a form of therapy or a form of some type of relief, and showing how it dates back to different communities and how people are still, of course, using it around the world today was something I really enjoyed. It lets me know that this stigmatization is something that we're dealing with here, but other communities, other cultures, and other spiritual, of course, entities, as you mentioned, they don't see the same taboo that we have over here. So I'm definitely very excited about what Cody was able to put together. He has a great amount of passion that he also pours into things that you're able to see come through in the actual modules. So definitely one of my favorites.
Yeah, absolutely, and we'll have a Canna Talk with him, I think, scheduled in December. And feel free to answer Q&A with Cody is always a blast. I've done a couple of sessions with him.
It is.
But he's incredibly passionate and definitely one of the key leaders in this industry when it comes to healthcare.
Agree with you. And while we're also on the topic of Cody, he's such a revolutionary right now within our field. He was actually able to author 2 of our modules. So the second module that Cody was able to author was a one called The Future of Cannabis Medicine, which is one that we all have our eyes on as of right now. A very interesting topic and something that people would love to know more about. So in summary, the future of cannabis and cannabinoid-based medicine is riddled with competing interests in powerhouse industries. Prohibition has led to difficulty studying the cannabis plant on both a molecular level as well as a large-scale clinical trial level as well. However, the endocannabinoid is an expanded scope of what science currently knows and what the questions that still need to be resolved as we move forward. This future implications of the knowledge are boundless and have the potential to significantly influence our approach to medical practices. So I've been able to review some of this one as well. And one of my favorite topics when it comes to the future of cannabis as a medicine is pharmacogenomics. So as you mentioned earlier, we know roughly about 144 or so cannabinoids to date, with much more possibly within the plant that we have not dived deeper into. But the idea of what does this look like for a patient? So when we look into Western medications, we're looking at specific dosing. We're looking at how it can work specifically for almost all patients. But there isn't quite a one size fits all as of yet for cannabis. So we're able to dive deeper into these actual terpenes, being able to dive a little bit deeper into these actual cannabinoid concentrations to see if we may ever get to a place where this specific strain is something that may be able to work more universally for patients in one specific condition realm. So I'm very excited about the future of cannabis as a medicine. And what was your favorite takeaway from this one as well, Alan?
Yeah, I think the biggest takeaway for me is the implications for the pharmacist's role in general. Like, not knowing, I get this message on LinkedIn a lot from other pharmacists that are like, how do I get involved in the cannabis industry? And the very obvious answer is the retail outlet. But in reality, the research, clinical design, there's all these different avenues that are opening up as research and access becomes available. We have to understand cannabis is still federally a Schedule 1 drug. So that inhibits a lot of research. It inhibits a lot of access. And, as the gates open up, per se, there's going to be so many different opportunities to develop new novel drug mechanisms. In the pharmacy world, we're also used to a very single molecule, single target type of mentality. This is how prescription medications are released. It's usually a single unit, a single molecule, and it's intended for a single purpose. Whereas with cannabinoids, we have a variety of almost an infinite amount of combinations that we don't really understand quite yet. And that's the really truly the unique part about plant-based medicine, because trying to harness one individual ingredient such as THC, that's only going to tell one side of a multifaceted story, right? We're starting to understand the rare cannabinoids, the minor cannabinoids like CBN, CBG, and even the acidic cannabinoids have their own therapeutic potential and therapeutic purposes. So, seeing what's going to happen in the future, there's a lot of competing interest as well, because it's not just the pharmaceutical world that's looking in. Big tobacco, big agriculture, everyone really wants to get involved with their own agenda. And, to keep this as medicine and truly harness the power of the medicinal benefits, we have to be able to speak coherently about it. Education is not something that we came across. When I went to pharmacy school, the only mention of cannabis was in a class called drugs and toxicology.
Mhm.
And so we were still talking about the negative sides of cannabis. I didn't learn anything about the endocannabinoid system, the ECS, in school. And Bobby took a master's program just to learn about that. But I don't know if pharmacy schools or medical schools are teaching about that now. So seeing where the future lies and the opportunity, I think that's what really excites me about being a pharmacist in this space, because it can go so many different routes. Do we want to even have this as a pharmaceutical prescription item? My personal opinion is no. I would rather see cannabis be a nutraceutical item similar to an over-the-counter medication, something that has access to the general public without being restrictive. But on the other hand of that conversation, I do want to see this being covered by third-party reimbursement. So, when is that going to happen, and how does that happen is still yet to be seen. So understanding the future implications is really what excites me about being in this industry. And even if you get in now with Bobby and I's experience, 2-3 years, we're considered dinosaurs in this space. But
Very true.
even if you get in now, I would still say we're still on the ground floor, and we're just on this trajectory to really have so many different avenues of opportunity here.
Mhm. I agree with you. And just to add a little bit of cherry on top as well, the idea of being in the industry, I see how much of a need there is for pharmacists. So if you are a pharmacist who has any type of interest within this space, I can definitely share that there is a window for you to come and join us. Not only, of course, we have it on the patient aspect value, but when it comes to formulations, when you're formulating a product, a pharmacist is very beneficial with understanding what, of course, combinations of cannabinoids and terpenes may be most optimal to a therapy. When you're, of course, dealing with a pharmacist as well, we have applications towards research. So we understand what may be the most optical question that we're looking for, or what, of course, answer that we're looking for as well. So pharmacists have a host of different ways to get involved with the medical cannabis industry. And that's one thing I want to empower us all to do. When you ask which ways can you get involved with cannabis, it's almost at this point, which ways can you not? Because whatever way cannabis as a medicine is moving, there is a space for a pharmacist there.
Yeah, absolutely. So the last module that we have is entitled Cannabis and Policy: Impacts on the Healthcare Environment. So as a summary, federal and state policies often affect the complete patient experience spectrum, all the way from the clinicians that are providing care down to the products that are being consumed. So oftentimes cannabis policies are written with meaningful intentions, but the translation to patient care is absent or obscure. So a delicate balance exists between policy, enforcement of those policies, and ultimate impacts on patient outcomes. This is a byproduct of what's happening across the US. So, individual states, because of the federal illegalities, individual states are creating their own medical cannabis programs. And while they're trying to mirror and copy each other, the actual practice and outcomes is that 38 states have their own medical programs. So there are 38 individual ways where patients are receiving medical care. Down from the process of how to obtain a medical card, how frequent you have to visit your provider, all the way down to the dispensary level, where do you have access to a pharmacist or a clinician or any kind of medical professional to ask more advanced questions, or are you talking to, you know, a 20-year-old bud tender with basic knowledge of what cannabis is?
Mhm.
And then in addition to that, the products, product labeling is not uniform. Lab testing is not uniform. And this is not the fault of the individual state, but at the same time, that translation of patient care, we're used to, as pharmacists, dispensing the same medication on, you know, on the East Coast as it is the West Coast. Whereas if you say OG Kush or a cultivar of cannabis, it can be indoor grown on the East Coast or it can be outdoor grown on the West Coast. It has the same name, same genetic lineage, quote unquote, but it's completely different cannabinoid profile. So how does that ultimately impact the end user experience? It's very questionable. So we go through a lot of high level topics such as what is the difference between descheduling and rescheduling, how labeling has an impact or lack of labeling can have an impact on patient care, and a lot of these key initiatives that pharmacists may be struggling with. To give an example on a different scale, a couple of years ago, a lot of hospital and healthcare systems would refuse to touch cannabis on the fact that it was a Schedule One substance, and some of their federal funding would be in jeopardy if they were dealing with cannabis. I think that conversation still exists today, but not as prominently. So what we're seeing is individual states creating laws, such as California, where they implemented Ryan's Law. It's essentially a right to try treatment where patients in hospital settings or hospice settings, long-term care settings, are able to use cannabis products. Now, how do you develop an infrastructure around that where education protocol on keeping products on site? There's a huge conflict of interest from multiple sides. Everyone is navigating regulations, and you know, lawyers are really great at their job in interpreting those regulations, but they are literally defining things, whereas the end patient impact is really what we're concerned about, right? How do
Mhm.
we provide the best care for our patients in a timely manner with what's available? We can't wait for regulators and legislators to figure things out and really give us the script, because you know, we have the opportunity to provide patient care, so why not do it? We just have to understand the intricacies that go into that conversation, no matter who is listening in, right? If you have a regulator, if you have a third party reimbursement, insurance company, they all have different agendas to fulfill, and we're trying to navigate this complex puzzle of legislation to go along with cannabis care. So what about you, Bobby? What was your biggest takeaway from this module that really spoke to you?
Oh, great question. Because since I'm in Virginia, Virginia tends to have a different framework for cannabis as a medicine in comparison to some of the other states. So one thing I really enjoyed was almost the comparison and contrast of what it looks like in some of our different states across the nation. So just to give an example of where I'm located, here in Virginia, our medical cannabis program is overseen by the Board of Pharmacy. And through that, pharmacists are mandated to be involved in the process. If you were to come on site to a facility within Virginia, you would see a staff that includes pharmacists, pharmacy technicians, and other healthcare professionals that have been trained to work in this style environment. But when you look at other different states, like to our north, we have Maryland that has a slightly different variation that still requires a healthcare professional to be involved in the process, but doesn't mandate whether this person comes from a pharmacy, MD, DO, nurse practitioner, PA. They can have a host of different backgrounds and still be applicable to this role. And then in complete stark contrast, right over to our left in West Virginia or to our west, West Virginia is a medical program that is overseen by a healthcare body, but it does not mandate that an actual pharmacist be involved within the process and actually keeps them far away. So just as you look within the area where I am, we have three completely different models that even though it works well for the patient, there is no uniformity, no standardization. So that was something that was definitely pointed out throughout this module, but it also offered some solutions for the future. It definitely was not something that pointed out all the problems within the cannabis industry. It pointed out a few, but then spoke to the solutions and the positivity about what's to come in political realm. So I'm very excited about this one that Farzana was able to put together for us.
Yeah, absolutely. So to kind of to summarize and close out, like I just want to get your thoughts, your personal thoughts. Like, where do you see the future of cannabis-based medicine going? And you know, what excites you most about that pathway?
I think what excites me most about cannabis as a medicine is almost what frightens the pharmaceutical industry as of right now, is the unlimited power of this plant that we're slowly but surely starting to tap into. I think that hopefully as we get into the next 5 to 10 years, I'm expecting much more research to be slowly but surely coming out. I know there's already been a host of doors that have started to open for CBD research that we're expecting to have some new results in the near future. And I'm very excited about getting able to push this out on more of a national landscape. As we've been mentioning slowly but surely throughout our whole conversation, there is not quite yet that uniformity or standardization in cannabis therapy and treatment. Even within one facility, each pharmacist may recommend a product differently to a patient, and depending on who you met with, you may not receive that same recommendation. So it's very, very unique with each interaction, and I would love to see more standardization across. But one thing that I always throw out, even with standardization, each cannabis patient is different. So even though this may be a standardized therapy, hopefully we can get to that point to provide relief in this specific condition. It may not be something that could work for any and everybody. So still being able to have pharmacists involved or some level of healthcare professional involved in the medical cannabis industry is something I'm very passionate about. I know sometimes, depending on which state you're in or what the program currently looks like, there has been some pushback on having an actual healthcare professional physically in place with different situations. But what I've seen from patient interactions is that it's definitely a bonus and that it's definitely a benefit. Not only are they able to have direct consultation with somebody who is actually invested in their therapy, but they're also able to lead with somebody who understands drug-drug interactions. I know we didn't speak too much about that, but that is highlighted in Alan's module. We can speak to that. We can speak to what this legal landscape looks like. We can build a relationship with their certifier or whoever the practitioner is who allowed them to, of course, come from medical cannabis and create really that triad of care that we see also in Western medication. So I'm very excited for that, to see exactly what comes in the future. But to flip it over to you as well, what are your thoughts about cannabis as a future medicine?
You know, I'm excited because I've said this time and time again, but pharmacists specifically have an opportunity to get involved in so many different avenues, and it starts with just being able to speak about it. Through my travels, with healthcare professionals especially, who are very logical in their education, their assumptions, and their decisions. It's a polarizing topic. You'll find physicians who either, you know I I've come into a lot of physicians' offices where they either don't want to speak to you at all because they don't believe in the conversation that you're having, or they're 100% on board. There's no real middle ground of really that. I don't want to say make this, an old school versus new school type of thinking, but that's what it kind of is. And us as pharmacists have the ability to advocate for it and craft the regulations in the way that we see fit. So, because cannabis is new, it's emerging, and legislation is still being written on the federal level as well as state level, we have the opportunity to integrate our thoughts of what works in the pharmacy world and what doesn't work in the pharmacy world to try to prevent that from happening in the cannabis industry as a whole. So, being able to speak confidently and being able to shout it from the rooftops, I think that's a great segue into advocacy. We talk a lot about being cannabis advocates, and no matter what platform you stand on, we're constantly fighting an uphill battle with people, whether it be the people on the naysayers, the people who still quote it as the devil's lettuce, all the way up to the clinicians that are like, well, I grew up in the DARE program era, and this is what I learned. And they refuse to have a conversation to even open up that dialogue about what is the endocannabinoid system. So being able to talk about it, that's the first step for pharmacists. Getting involved on a individual level, whether it be a state organization or the Society of Cannabis Clinicians, the ISCPH, International Society of Cannabis Pharmacists. There's a lot of groups out there that are pushing the ball towards the right direction, but it takes numbers. It takes volunteering. It takes a lot of manpower to get this message out there. So while Bobby and I have this in our kind of wheelhouse of being able to talk very coherently about it, someone who's looking from the outside in may not feel as confident. So this is what this course aims to provide, just a basic platform for all of us to stand on, to see what we understand and where we still need to go. What about you, Bobby? What does advocacy in this space really mean to you?
I think advocacy for me as of right now is actually getting out to the forefront and voicing the need for a healthcare professional in between, of course, some of our more bigger cannabis industry bodies, right now, and the actual patient. I think that when you look into some of your larger cannabis industries, they may not have anybody who is actually interested in that patient care interaction or looking at it as a patient-centered approach. So I think when I advocate, I tend to advocate for the patient, because this is not always the person who's put at the forefront right now in the cannabis industry, as when you look into other healthcare spaces. But one thing I'm also very interested in advocating for is the idea that I have to be honest and understanding that I am working in an industry, as you mentioned earlier, Alan, that has put a lot of people behind bars. And unfortunately, there are people who are still actively locked up for doing things that I get to put on a white coat and do and speak, of course, in the most professional way. I think that's something that not only as I advocate for the pharmacy field, I also advocate for those who are locked up or have been affected by some of the criminal, of course, legislation or anything out there that may have affected their livelihoods. As we go ahead and start to wrap things up as well, did you have any closing remarks or anything you want to share with the group, Alan? Like I said, I really appreciated you throughout this whole process. Not only has he been a great friend, but also a great mentor to look into as well in the cannabis space. He has a host of knowledge, and he's definitely somebody that I would push all of you all to connect with if you're not connected with him. But what are your closing remarks?
Yeah. Me personally, as a pharmacist, I've seen the decline of what a pharmacist is over the years. With the amount of burnout that's happening with retail pharmacies, with the amount of just kind of the corporate structure, the focus on KPI metrics, and Kristen made a great point. People care just about the money, and unfortunately, these are factors that we are still dealing with in our industry right now. There's a very one-sided approach that capitalism is driving this market. And in reality, I would tend to agree with that statement. But also, I understand that we, again, have the ability to move and push the ball the way that we want it to. So never lose track of what's important and why we went to medical school, pharmacy school. We are here for the patient. We are here to provide patient care and have an understanding of what the patient is really looking for. So all these confounding factors may really play in as a kind of heavy umbrella that's covering the industry right now. But at the same time, working through traditional pharmaceutical medications, traditional pharmacy, we kind of know what we're going to get into when we step foot into the pharmacy, when we step foot into the hospital. This is something new and interesting that really has huge waves of implication in the future that I really believe in. So to be able to share that message with others and similar kind of like-minded people, I think the SEC, and I want to thank the SEC very for giving us this platform to be able to do that. So Bobby, you've been really helpful through this process as well, and I rely on you just as much as you do on me. So even though we may be subject matter experts now, 5 years down the night, 5 years down the line, this industry may look completely different. So hopefully we're gonna be, riding that wave as long as we can.
I agree, my friend. I
Yeah.
agree.
Well, what about you? Any closing remarks that you'd like the audience to kind of take away?
Definitely. I think that you poured everything out perfectly, speaking from a cannabis pharmacist experience. But one thing I want to highlight once again is the idea that this module is going to be something that if you do get the opportunity to purchase it and participate, I think you'll walk away with a great grounding understanding. I think this is something that lays all of the framework for basic understanding as a pharmacist stepping into the cannabis world as someone that's new and inexperienced. And if you're somebody who's already been in this space and wants a little bit more polishing up, I learned quite a few new pearls that I did not know prior to, of course, purchasing and completing this actual module. So this is not only something that we enjoy talking about, but it was something that we enjoy putting together to present and hopefully offer a new step towards this uniformity, as you mentioned at the beginning. We don't have anything like this out here in the pharmacy world that I'm aware of. So you are a trailblazer right now, Alan. So thank you for being a part of this journey with me.
Yeah. And to address some of the questions that are coming in, don't forget about us, therapists, psychologists, psychiatrists in the clinical space. Absolutely. That's one part that is really going to be interesting. Seeing how psychedelics market is rolling out in kind of clinical settings where it's assisted therapy. I think there's a space and time for that in the cannabis space, honestly. And, it's going to be, even though it's treated as a retail commodity right now, there's a world of opportunity in shifting perception and mindsets, and to use cannabis as a vehicle to deliver that. So thank you for bringing that point up, Kristen. Okay, so Sarah, O'Hanlon had a question. I'd like to hear about the pharmacokinetics of cannabis administered in routes other than oral and how these routes impact liver enzyme levels with regards to drug-drug interactions. So this is an interesting conversation. And, I don't think we've discussed this, Bobby. So I'd love to hear your thoughts on this. But when we talk about things like sublingual tinctures or lozenges or troches or something that's supposed to dissolve in the buccal cavity,
Mhm.
My hesitation with telling people about the pharmacokinetics is that I don't know how well these base vehicles absorb. So traditional tinctures are usually alcohol based, and what we see, cannabinoids are lipophilic, so they're lipid soluble. So they need some sort of lipid soluble medium to deliver the cannabinoid. So most times tinctures are made of large molecules like MCT oil, medium chain triglyceride oil. I've seen some polyethylene glycol bases, and how much of that is actually absorbing in the buccal cavity, I have no idea. Because you can hold it there for 5 minutes, but ultimately the majority of the medication becomes swallowed. So it becomes oral ingestion, which goes through your digestive tract, which goes through first pass metabolism through the liver, and so on and so forth. So I can't really answer that because I'm not aware of any pharmacokinetic studies that are really going through how much is being absorbed in the buccal cavity. I'd love to hear your thoughts on that, Bobby.
Yeah, so pretty similar to what you're saying. As of right now, research is not standardized enough to the point we can confidently speak on it, but I can share highlighting what you mentioned as well. Alcohol being used as portion of the base does help to increase a little bit of the, of course, aqueous absorption throughout their buccal cavity. So adding some level of alcohol into your tincture mixture is going to be preferred administration based, compared to an all oil based formulation. But outside of that, there's not much more research that prefers one over the other. And we definitely don't have research that can state as to how much of an effect it would have on the liver. I would guess more on a national basis or more on basis that would apply to most patients. But one thing I can say in general, we are aware that cannabinoid administration can have an effect on your liver. So if this is a patient that already has some liver insufficiency or is already dealing with a liver disease, this is something we want to take into account for. So what I've dealt with a liver patient in the past, this is something where it's not the option where they cannot consume cannabis, but they may want to minimize their dosing or space out a little bit more. So the idea of, since it's not clearing your body quicker, instead of consuming every 4 to 6 hours, let's look at every 8 to 12, or depending on what level of liver inconsistency they do have, let's look at dosing every other day, just to make sure that we aren't putting you in a space where you have more of an effect than you're expecting. But I wouldn't expect this patient, just because they have any type of liver problems or may be concerned about that, to be somebody that we would have to push away from cannabis therapy.
Yeah, agreed. To answer Sarah's question, do you think this coursework can be applicable to non-pharmacists? Absolutely. Like we created this with intention of having an ACP accredited course, but on the larger scope of things, anyone related to healthcare would benefit from these modules. And there's a discounted price for non-ACP accreditation. Is that correct? I think.
Yes, exactly.
Okay. Yeah, so people who don't need the accreditation can still take the course at a discounted rate. So absolutely. Yeah, I see your messages, Raul, and maybe Bobby, you want to speak to kind of how politics play into the industry, without going too into detail, obviously, because we want to remain bipartisan as clinicians, because realistically, what happens on that level, we don't really have control over. We're supposed to be purveyors of change, but at the same time, we're kind of restricted based on what regulations come out. So how do politics and policies really impact the cannabis space, Bobby?
They actually have a very, very huge impact on the cannabis space, and even taking it all the way to the granular level of working at the storefront, making sure that these employees of these storefronts are protected is something that is a very unique topic and conversation. I would say from the SEC's perspective, we support cannabis being produced as a medicine, being displayed as a medicine, having education to support that, as well as making this cannabis as a medicine available to the patient population in the widespread. So we want to make sure that we are pushing to decrease any barriers that we may have to patient access, decrease any barriers that we may have to patient education, and making sure that the taboo around cannabis as a medicine is reduced. So whatever type of legislation can be created to support that will be something that I would suspect SEC to be behind as well. I know there are a lot of topics and conversations going on within the cannabis space as of right now, dealing with its schedule and what we may or may not be able to do with it. So the idea, once again, of just making cannabis available to as many medical patients as possible with as limited amount of barriers is something that I'm in support for.
Yeah, absolutely. Honey, your question for is alcohol better absorbed than oil-based tincture? The actual definition of tincture comes from an alcohol base. So most of the pharmaceutical items that come in tincture form are alcohol-based. And unfortunately, alcohol does not necessarily mix well with cannabinoids, and that's why we're seeing other delivery vehicles like MCT oil. So that was in regards to the absorption question.
Correct. So to highlight and add a little more context to it as well, the idea where alcohol versus an oil in general, removing the idea of a cannabinoid concentration being added to it, alcohol would be better absorbed within the mouth. But as Alan has mentioned, since cannabis and cannabinoids are such lipophilic molecules, we have to introduce some level of an oil or some level of a lipophilic, of course, entity to make sure that this can be absorbed across your blood-brain. So to make sure we get all this wrapped up into one, we aren't quite sure yet whether you're getting more cannabinoid concentrations from an oil base versus an alcohol base. That's where more research will need to be done to give that concrete answer. But in general, removing the concept of a cannabinoid concentration being added, alcohol is better and more readily absorbed throughout your buccal cavity in comparison.
Yeah, great summary. All right, so we got a couple minutes left, and I just wanted to again say thank you, Bobby, because it's been a long time coming for this module, and Christine, you've been really helpful for bringing this to life as well. The SEC has been extremely supportive, and the only way is up, right? From here, we have a lot more groundwork to do if we want to get this message out there. And so share this with your network, share this with your platform, whether it be a state organization that supports independent pharmacies, or, I know NJPHA has individual state chapters. Whoever you think would benefit from these modules, don't hesitate to reach out, and the SEC can figure something out where we can have a group package or other avenues like that.
We'll go ahead. We'll pass it back over to you as well, Christine. We're at the point now where we've had some great conversations. I think we answered some great questions, and we're all ready for the SEC close and wrap up. This was another great Canna Talk. Glad to be a part of it.
Yeah, this was so great. No, thank you so much, Alan and Bobby. This was fantastic. I just want to reiterate, the modules are amazing. I've had the privilege of going through them. And to give a few of the dates, I did put them in the chat, but mark your calendars. We have all the rest of the authors who are going to come on to an episode of Canna Talk with our co-directors and share a little bit more in depth about their individual modules. November 16th, we have Dr. Michael Ruggiero. December 7th, we have Dr. Cody Peterson. And then to start us off in 2023, on January 11th, we have Dr. Farzana Kennedy. So these are going to be really great talks. They're all going to be free and open to the public. So whether you're already an SEC member or if you're a non-member considering joining, share these events with your colleagues. This is a great way to introduce the subject to even some family or friends or colleagues or your clinicians who might not have the education on cannabis like we know is so needed in all clinical and health professional schools. So we hope you join us for these upcoming episodes. And thank you so much all for being here. And as Bobby mentioned, if you are working with a state agency, if you're working with a group of pharmacists, contact us and we'll be happy to set up a group package with a discount. We really want to just get this education in front of as many pharmacists and other clinicians and people in general as possible. So thank you all so much for being here and supporting the SEC.
All right. Thank you.
Bye, everybody.